Hi, welcome to In the Nose Gut Check. I am your host, Arielle Simone, a certified holistic nutritionist, and today we're going to talk about how to feel better, from gas to bloating to stomach discomfort and fatigue. We will be talking with Dr. Dibba to how to get our energy levels up and just overall feel better. So let's go, guys. Let's go talk with her. Okay, so Dr. Dibba, what is the main function of the gut in the body?
So the gut essentially digests food, absorbs nutrients, and eliminates waste from the body.
Why is that important?
Well, the gut actually is connected to so many organ systems in the body, and really it can affect multiple other organ systems, including our mental health, which I think is a really important topic that we're going to cover today.
One sign or symptom that I experience all the time when I can tell my gut might be a little off is bloating, excessive bloating. Can you tell us what's actually happening when we're feeling bloated?
Yeah, that's so funny that you bring that up because I feel like bloating is one of the most commonly asked about symptoms related to gut health. So bloating can actually represent certain pathophysiologic processes that are going on in the body, inflammation or disorders of the stomach, the small intestine, the colon, the mesentery, which is the tissue surrounding some of those organs. And sometimes it can be reflective of things that we're consuming on a day-to-day, diet, stress, and a span of other disorders that can manifest as bloating.
Mm-hmm. Is there anything in particular that we can do to reduce bloating?
In terms of daily lifestyle things that people can do, I really find that thinking about dietary consumption or certain habits like your caffeine use, your alcohol use, any form of smoking, those are things that you can try and see if you can correlate to symptoms to see if there are things that you can change in your day-to-day that might make you feel less bloated.
So I'd love to talk about fatigue and overall just feeling very tired. How does the gut health play a role in that?
So that's interesting that you asked that. I mean, just think about having inflammation in your body, thinking about, having severe abdominal pain or diarrhea. I mean, from a pathophysiologic perspective, if you're losing important vitamins, nutrients, minerals, just things that can contribute to your energy in a day, obviously you're going to feel fatigued. And that, even from a mental perspective, I think when there are gut illnesses going on, it can be taxing from a mental perspective, from a psychiatric perspective. And so that can also contribute to symptoms of fatigue.
Mm-hmm. So if someone is feeling overwhelmed, where is a good place to start as far as how we can start taking care of our gut health?
That's actually a great question. I think food and symptom logging is one of the best tools that somebody can use on a day-to-day to try to figure out what's contributing to their symptoms. Literally writing down the things that you're consuming, whether that's a drink, whether that's a food product, snack, or some sort of supplement, and then also writing down when exactly you have your symptoms, just so that we can try and correlate what is causing the symptom.
Oh, kind of like a tracker.
Yeah.
Oh, that's so nice.
Yeah.
Is there anything else that we might need to know to take care of our gut? What are some key takeaways that we can start doing to help us have a happy and healthy gut?
I think being really aware of everything that you're putting into your body and really correlating that with symptoms if symptoms are present, being active about consuming adequate fiber, whether that's from fruits and vegetables or supplementally, and knowing when to actually seek medical help when you're having symptoms that are really not responsive to lifestyle modifications. There are so many things that we consume on a day-to-day that are really contributing to our gut health, but it's also important to note that even when you're doing the best things that you can do for gut health, you might have an underlying process that really needs to be addressed medically.
Mm-hmm. Thank you, Dr. Dibba, so much for joining us today and helping us get clear on how to get our gut health to be happy and healthy.
Absolutely, it was my pleasure, Arielle, and it was nice meeting you.
It was nice meeting you too.